Good morning. Today is Friday, May 8th. My name is John Kinseth. I'm the Deputy City Manager of the City of Decatur. This morning I want to give you an update on the bigger picture of where we are, where we're going. We've managed to survive 6 weeks of the stay-at-home order, and we have what it looks like at this point is at least 3 more weeks moving forward. There has been some changes of the rules along the way, and we anticipate some continued changes as we continue to move forward. Yet last Friday, the governor announced the extended stay-at-home order through the end of May with some of those changes, and really announced a 5-phase plan, which we are currently in phase 2. Our goal is to get to phase 3 and beyond as quickly as we can in a responsible manner. As it sits today, it looks like Decatur and Central Illinois may potentially be able to move from phase 2 to phase 3 on May 29th. What that means is that now is the time for all of our businesses, our residents, nonprofits, organizations generally, to begin to make the changes necessary to responsibly reopen when they are allowed to do so. What I'm talking about is lines taped on the floor for social distancing, plexiglass installed between your employees and the general public. Those types of modifications that will likely become the new normal for the next few months, at least potentially the next couple of years. The city can help with some of this. What I mean by that is that the same way that the city provided resources and assistance in creating drive-up lanes for our restaurants that now we're doing curbside pickup, the city has also offered to help our retail businesses that need to create a drive-up lane to get their product out the door with the new format that the governor has allowed non-essential retail to open under. We are also working on securing face coverings for our transit riders and homeless populations to ensure that everybody has a face covering so that we can responsibly reopen. We're all in this together. The only way this works is that if we all do our part. The face coverings are required, and they are important. If our community spread grows faster than what our hospital capacity can keep up with, we ultimately will take 1 step forward and 2 steps backward. That is not our goal. That's not our desire. All of us need to do our part so that we can continue to minimize the community spread and responsibly move forward in a positive way while keeping the cases at a number that is manageable. As of right now, we're at 135 cases, 15 deaths here in Macon County. We like to hold that number at a rate that is manageable for our healthcare system here in the community. Over the last 6 weeks that we've been in this stay-at-home order, certainly one thing has become very evident. This crisis has impacted people very differently. Some people have been furloughed, some people have been laid off, some people are working 12-hour shifts to keep everything going. This is the time that we all need to band together. If you're one of the people that are still working, we thank you. If you're one of the people that are at home not working, we apologize for the inconvenience, for the hardship that it's created for you, but we are all in this together, and we are doing everything we can to provide the necessary resources to continue to keep you on your feet. There are wonderful organizations here in Macon County and Decatur that are here to serve you. United Way and a lot of other organizations do have resources that are available to you. Please reach out to find out what resources that are available to you as you need them moving forward. Got notice today that the bulky item pickup will be restored for waste management as of Monday, May 11th. So as of next week, you can continue to or start to put out your bulky items again for pickup at the curb. While we go through these last 3 weeks of the stay-at-home order, now is the time to continue to clean up your property, prepare for spring, so that as we reopen, we can put our best foot forward, and Decatur will look the best it's ever looked as we move forward out of the crisis that we are currently in. Lastly, the City Council will have a study session on Monday, May 11th, where we will be discussing the financial impact that this has had on our budget and what that means for our staff and our services moving forward. Certainly the goal is to maintain services as they have, but we will have to tighten the budget the same way that all of our businesses and all of our residents have had to. So if you're interested in that, look forward to more information coming out about that next week. Thank you, and have a good day.
Hi, this is Tom Mall with SIU Family Medicine in Decatur. I'm a licensed clinical social worker. Today I'd like to talk to you about coping with stress, anxiety, and depression during this time of COVID-19. People who have already suffered with anxiety and depression are experiencing an increase in symptoms during this difficult time. Conversely, people who have never suffered from stress, anxiety, and depression are also increasing symptoms for the first times in their lives. This can be quite scary. The big part of COVID-19 is not only the health impact, but also the psychological and the pain that people are feeling from being so isolated, depressed, perhaps experiencing loss of work or loss of means to take care of themselves for the first time. The following is just a few simple tips to try to help you cope. Remaining on a schedule helps a lot when you're at home. During the time when we're not at work or not going out amongst our friends, it's important to try to sleep and wake at about the same time every day. This is a little bit difficult. It may take some practice, but with some good timing and also taking care of ourselves appropriately throughout the day, this is still possible. It's important to eat regularly and sometimes healthily during this time as well. Remain on your medication schedules prescribed by your doctor for all medical and behavioral health needs as well. Remember, it's okay to still socialize. It's okay to use technology to reach out to friends, neighbors, and loved ones. It's okay to make calls on the phone. It's okay to reach out to people you haven't talked to in quite some time. Chances are they're experiencing the same things that you are as well. It's okay to share emotion and feelings with each other. It's also okay to reconnect and find some joy in old story sharing or perhaps having a funny moment between yourselves. It's also important to realize there are activities that we can do to change emotions that we want to change. For instance, if you're having a lot of strong emotions and not coping that well during the day, it's okay to put on music that does make you happier. It's okay to read a book that can pique your interest and take your mind off and compete with the strong emotions that you're experiencing at the time. Other people may want to watch a movie or a complete series on TV to make sure that they're coping well. It's also okay to do the yard work and do anything around the house that can help you cope better and strategize how to keep your days busy. Also, people can use this time to make sure you control the consumption of news, or what I call bad news, throughout the day. It's important to stay up to date for your health and well-being, but it's also okay to limit the amount of time that you're consuming this time's rough news schedule that we're experiencing on a daily basis. I also encourage people to use mindfulness skills. Mindfulness skills are wonderful. They help you connect to yourself in the moment. It's as simple as going outside, feeling what the sunshine feels on your face, noticing the changes in your yard, such as the green grass or how the trees are blooming, and also taking charge of how you can help maintain emotions in the moment. Other mindfulness skills would be looking up a brief meditation, or also taking time to name objects outside that you haven't typically been paying attention to. Some people are even taking walks where they're naming objects and looking around themselves to notice things in their town or their little area that they haven't been paying much attention to. It could be from hearing the dogs barking to noticing how the leaves are blowing in the wind. So using mindfulness skills are also beneficial. Lastly, I'd like to talk about controlling things that you can. A lot of anxiety happens when changes are occurring around us and we feel we have no control. There are some things we can still control. How we talk to each other, how we respond to each other, random acts of kindness that we can still do for each other without even thinking too much about it. Getting outside of yourself and what you're feeling in the moment is another excellent coping strategy. Please take care of yourself, take care of your loved ones, and take care of each other. Thank you.